The reason cyclists have a higher percentage of back pain is most likely related to the seated posture of cycling. Exercising in this seated position trains the hip flexors in a shortened state, which can lead to adaptive shortening of the hip flexor muscles, which then lead to affecting your posture when you get up off of the bike. Chronically tight hip flexors pull the pelvis forward into a position of anterior pelvic tilt, which affects the lumbar spine in the standing position. The sitting position of biking actually alleviates symptoms related to anterior pelvic tilt because it takes the tension off of the lumbar spine when the hip flexors are shortened or put on slack. So the problem that cycling causes actually occurs when you get off of the bike, because the standing posture requires that the pelvis can sit in a neutral position to have a healthy spinal curvature. So it becomes really important that cyclists cross-train by doing exercises that lengthen the hip flexors both before and after taking bike rides so that they can counterbalance the effects of training in the seated position, which can lead to the adaptive shortening of the hip flexors.